So how do you get from a neck on the left to a neck on the right? Everybody wants that sharp, defined neckline with a sharp jawline. How is this actually done? So the procedure that's required to get the sharp, defined jawline with the sharp, defined neckline is a deep neck lift. What does that actually entail? A deep neck lift includes subplatysmal dissection, and I'll go through what each one of these things mean, trimming of the digastric muscles, removal of the fat below the platysma, removal of the submandibular glands, as well as tightening of the muscle. It does not involve liposuction, and this can all be done via just a little bit of a submental incision right in here and does not require any other incisions. So this slide clearly illustrates what the platysma is. The platysma is a muscle that basically wraps the neck like this. This is the main structure that creates kind of a boundary for us. Underneath that platysma, we have some fat in this region, okay? Underneath that, we have muscles that go from here to here on both sides. Those muscles are called the digastrics. And then we also have glands that live right in this. All of those deep neck structures create fullness in the neck that prevent that sharp jawline, sharp neckline. So this slide clearly illustrates the digastric muscle and the location of the submandibular glands right here and right here. Here's a lovely young lady with exactly this issue. She's young, she doesn't have a lot of ptosis or droopiness in this area. She just has a really full neck. She says it's bothered her forever. This next slide clearly shows the amount of fullness and redundancy in this area. So this is not someone who really needs a facelift. A facelift is someone that would really need elevation of this area, the mid-face structures, but she really doesn't need any of that. She really just needs definition of the jawline and definition of the neckline. So here is her immediate on-the-table result. We did a deep neck lift on her in which we debulked those tissues, and you can clearly see the definition we've already achieved in the neck. This is in the operating room where the tissues are still swollen. You can even clearly see the drain in place. Furthermore, all of this was done under local anesthesia with simply just an incision right underneath the neck. There are no incisions that are done behind the ears on this patient. You can clearly see how much tissue was actually excised in this case. This is some of the fat that was removed, some of the glandular material that was removed, and some of the muscle that was removed in this area to give her that sharp, defined jaw and neckline. And here you can start clearly seeing the development of that neckline just 4 days after surgery. So what's special about this patient? Many times patients that have a full neck will be recommended by many plastic surgeons to undergo neck liposuction. The problem with this is that neck liposuction only addresses the fat in this region. It really doesn't address any of the musculature as well as the glandular material that is really causing the fullness in the neck and decreasing the amount of sharpness that can be achieved in the neckline. If you have questions about a deep neck lift or whether this procedure is right for you, don't hesitate to give us a call. And please stay tuned to see this woman's lovely follow-ups as her journey progresses.